I'm going to get started. So when I started treating Lyme 10 or 11 years ago, I thought that it was going to be kind of like treating any other infection. So you give somebody antibiotics and maybe you have to adjust them a little bit, but ultimately they get better. And you'll be shocked, I'm sure, to hear that it's not quite that simple. Sometimes patients will get somewhat better and then they plateau, or they seem like they're all the way better, but then they relapse. And some patients get sick with treatment and they actually get worse even with the most gentle of herbal treatments, and so it's very frustrating. So why is it that people don't get better? So the first thing is Lyme disease is a very tricky bug. It can remain dormant in our systems and the infection can persist even when it doesn't look like it's there. It can suppress our immune systems and be able to come out of hiding, and it is also able to evade detection. But I think that that's not quite all of the problem. What lets Lyme disease out of jail? What allows Lyme disease to persist or to come out of hiding? So we all know about the co-infections. You want to yell out co-infections to me? Bartonella, Babesia, chlamydia, anaplasmosis, yeah. So there are a lot of co-infections, and we know, thank you so much, we know that there's a synergy between these infections and they really help each other to wreak havoc in our bodies. But even when we treat co-infections, sometimes people still don't get better. So what else is going on? So those of us that treat Lyme disease over the last couple years have really been able to look at other possible explanations for this, and there are a couple of things that have become very kind of like the new cool things. One of them is mast cell activation syndrome, and the other is mold toxicity. And those are the things I'm going to talk about tonight. And my hope is that you can at least get a sense of whether these are things that might be problems for you or someone you know. I'm unfortunately not going to be able to give you all the information I'd like. That would be like a multi-day conference. But at the very least, you can kind of get a sense of what these do and how they act. And then, as I said, I'm going to give you some books at the end that will give you way more information than I'll be able to deliver tonight. Okay, so let's go alphabetically. Let's start with mast cell activation syndrome, which is affectionately abbreviated as MCAS for obvious reasons. It's a long name. MCAS is a hyperreactivity of a subset of your white blood cells. It seems to run in families, and about 3/4 of people who have MCAS can identify other people in their family, parents, siblings, children that have it. And it has like a really variable presentation. So it can be fairly mild. It can be people who have had like allergies and they went to the allergist and got tested and every single spot on their back lit up or nothing lit up, but they were told that they had allergies. So it can be fairly mild. It can be something that people just live with. It can also be as severe as persistent anaphylaxis, and it can actually be fatal. The prevalence has been estimated, this is a ridiculous range, from 1% to 17%. My suspicion is that it's probably closer to the 17, especially if you have the people who are the not quite as dramatically affected. And flares of MCAS can be caused by a lot of different things, including infection and including Borrelia. So this is a fairly blurry picture of a mast cell. Now you might ask, why is it called a mast cell? It obviously has nothing to do with sailboats. Mast actually comes from the root that means to nurture. So if you think of mastitis, mastectomy, so words related to breast, because in the late 1800s when mast cells were first identified, they thought that all these little granules had like globs of food to nourish other cells. In reality, what those granules have are many inflammatory mediators that the mast cell barfs out when it's irritated that cause inflammation in the surrounding tissues. So mast cells are actually not bad. They're very important for our immune system if they're working appropriately. But if you have mast cell activation syndrome and your mast cells are hyperreactive, it can cause all kinds of problems. So this is a slide that's pretty busy, but it has all of the different systems that mast cells can affect, which is basically every single part of your body. And I like to joke with my patients that Lyme disease got too easy for me and I had to find something even weirder and harder, which is actually, I mean, that's just a joke because Lyme disease is still very hard, but MCAS is like even more complex. The symptoms can be pretty much anything in any part of your body, and they can be contradictory. In one person, there can be bleeding problems. In another person, there can be clotting. One person can have diarrhea. The other person can have constipation. So it's not like, I mean, as variable as Lyme disease can be in its presentation, MCAS is even more complex. The classic symptoms of MCAS are related to the parts of your body that interface with the outside world. So our skin, our respiratory system, which includes your sinuses, your nose, your lungs, and then your gastrointestinal system, because we're actually basically big donuts, and our gastrointestinal system, even though it's inside our body, is not really part of our body. It's kind of like landing in the airport in a foreign country and you're in the country, but you haven't gone through customs, so you can't get into the country itself. So everything that passes through our gut has to be vetted to decide, is this something that's good for us to have inside or bad for us to have inside? So as you can imagine, a lot of our immune tissue is in our gut. So these are the symptoms that are the most common with MCAS. So the skin ones are related to allergy, as you could imagine. One of the biggest mediators that is produced by mast cells is histamine. So antihistamines are against histamine. So histamine will cause a lot of symptoms that kind of seem like allergies. So swelling, flushing, rashes, itching, hives. Respiratory symptoms, sinusitis, asthma, nasal polyps, allergies, and then all the gastrointestinal symptoms basically. The other things that are a little bit more specific to MCAS and more unusual are hypermobility. How many of you have ever heard of the term Ehlers-Danlos? Anybody heard of that? Besides the physicians and physician assistants in the room? Not. So Ehlers-Danlos is basically a hypermobility condition, and it's not really clear exactly how MCAS is related to it. That not everybody that has MCAS is hypermobile or double jointed, but there's a larger proportion of people that are. So anytime that I see somebody that has allergies and hypermobility, the red flags are starting to go up. The other thing that you can get is postural orthostatic tachycardic syndrome, POTS. How many of you have heard of POTS? Probably a few more, because that is something that's not unusual in Lyme disease. And you can also have just low blood pressure. Unexplained clotting or bleeding problems. We saw somebody in the office today who mentioned that she'd been put on the birth control pill but had terrible clotting problems and had a pulmonary embolus and had a workup that didn't show any explanation for it. So any kind of weird symptoms that don't make sense. And then a family history of other people that have similar symptoms. I had a patient who said, you know, I've started getting hives and my mom has had horrible hives and they're just getting worse and worse as she gets older. So laboratory diagnosis of MCAS. So MCAS is not only more complex than Lyme disease, the labs are even less reliable, believe it or not. And it's not that we don't have good tests for them. There are probably about 200 mediators that mast cells have, and there are about a dozen or so of them that we can test for. And the tests are pretty accurate, except that the things that we're looking for are very fragile compounds and are degraded by heat. And so if the blood is not collected in refrigerated tubes, it's not spun down in a refrigerated centrifuge. If the urine is not collected in a refrigerated cup and put in the refrigerator right away, you're going to get false negatives. Not only that, but the tests often are not even available in a lot of clinics, and they're often not covered by insurance because they're considered experimental. So how do we diagnose MCAS? So there's there's a term in medicine, does it walk like a duck, does it quack like a duck, does it swim like a duck, is probably a duck. So if I have a patient that has numerous symptoms that are very suspicious for MCAS, and they either can't afford the testing, or we do the testing and it's negative, I will often just say, you know what, I think you probably have this. And I will treat them with the basic treatment therapies that we use for MCAS. And if they get better, that, as far as I'm concerned, pretty much clinches the diagnosis. So how do you treat it? There are a tremendous number of approaches to doing this. The first, ideally, is to avoid triggers. And often people, by the time that they get diagnosed, already know that they can't tolerate alcohol anymore, or if they eat particular foods, it makes them feel very sick, or heat will make them have hives. And so the more that somebody can identify what the triggers are, the better they can avoid them. The basic strategy is to blockade histamine and to stabilize mast cells. And the good thing about it is that a lot of the treatments are pretty cheap. So antihistamines, we use the non-sedating antihistamines, cetirizine, which is Zyrtec, fexofenadine, which is Allegra, and loratadine, which is Claritin. And I'll usually have people rotate through them, take them for a couple weeks at a time to see if they feel any better on one versus the other. There are 4 kinds of histamine receptors, H1, H2, H3, H4. H2 blockers are ones that block. Does anybody know? Has anybody heard of the term H2 blockers besides the healthcare professionals? So H2 blockers are used to block stomach acid. And there are a lot of other H2 receptors in your body that it's worth blockading, in your nervous system, in your cardiovascular system. And so as much as I think that there's a reason that people have acid in their stomach, I will often have them at least try getting on the H2 blockers to see if that makes either their gastrointestinal symptoms or even any other symptoms better. Mast cell stabilization is accomplished with a number of different supplements, things like quercetin, palmitoyl ethanolamide, and a lot of things that are actually prescriptions. So there is cromolyn, which is available by prescription. And what we do is we basically kind of add on layer after layer of treatment, trying one thing at a time, because if you do more than one thing at a time, you don't know whether or not, which one is actually helping. And then there's this whole treatment ladder that goes up as far as like drugs that are used for chemotherapy that are very expensive. So the good news is that the simplest, cheapest treatments are actually just as likely to work as the more expensive or more dangerous treatments. And as time goes on, people with MCAS become much more aware of how their bodies react to things, and it becomes easier and easier to figure out whether or not something is beneficial or whether or not something is not working. So if you have good news, you probably have bad news. And there is some bad news, which is there's absolutely no way to predict which of these treatments are going to be effective. And it's a very tedious process of trying one thing at a time. I know people get very, very impatient. And so it takes a while to figure out what's going to work best for you. The other problem is that a lot of patients will react to things like dyes and fillers in pharmaceuticals. And so they may need to get specially compounded prescriptions, which are, of course, more expensive than just taking Zyrtec over the counter. Okay, let's switch now to mold. So mold belongs to the fungi family. So there's the animal kingdom, the vegetable kingdom, the various one-celled squishy things, and then the fungi. So the fungi include mushrooms, molds, yeasts, and that's where mold comes in. So mold is actually not all bad. There are like hundreds of thousands of different kinds of mold that have been identified, and probably only about 80 of them are bad for us, but the ones that are bad for us are very bad. How many of you like cheese? Yeah, so cheese is made by mold, so that's a good kind of mold. How many of you have ever been on antibiotics in your life? Does anybody know where antibiotics were discovered? Sir Alexander Fleming had a petri dish that he was growing mold on, and he noticed that the bacteria were killed around the mold. So mold creates what we call mycotoxins. Myco just means mold. Mycotoxins to protect itself from other things like other molds, bacteria, and we're just collateral damage. It's really not trying to hurt us. So, okay. Unfortunately, the problem's just going to get worse because with climate change, we're having increasing wetness in this area. I don't know about you guys, but I had water in my basement for the first time in the 15 years that I lived in a house this year. At least we don't live in Houston. I have a cousin there who has had to remediate her house twice after hurricanes. And there are two things that have been really interesting to me. I've only been working with the mold angle for the last couple of years, or excuse me, the last couple of months, about 4 months. And I'm astonished at the number of patients that mold is actually an issue for them. And I'm equally astonished by how unreceptive people are to the idea that mold is their problem. And I think part of it is that we think of mold as being like this. And hopefully none of you live in houses that look like this, but mold can be hiding. This is wallpaper with mold underneath it. This is a ceiling with mold in it that, unless you ripped it apart, wouldn't know. This is a really not great slide, but it's carpet pulled back and there's mold underneath it. And certain kinds of mold love carpet padding in particular. Others really love like drywall, like it's like mold puppy chow for them. And sometimes mold is hiding in plain sight. So this is a picture of an atrium of a hotel. And have you ever been in the hotels that have like the swimming pools in the middle? Well, that moisture has to go somewhere. And unless you look up, you don't notice that there's tremendous amounts of mold on the ceiling, as in a place like this. Don't forget your car as a possible source of mold. And if you think about being in that tiny enclosed space with all those mold spores, you know, if you feel sick when you're in your car, that's probably a good indication that your car has mold in it. A lot of people will say, well, I don't really have mold in my house. I mean, I know my basement is kind of dank and smells icky, but like that's in the basement. Well, where do you think the central air and the central heating come from? So the problem is that if you have mold in your basement, the air intake is pulling that air and spewing it all over your house. And this is a picture of the inside of an HVAC system. So I'm sure all of you guys are going to run home and call to get your ducts cleaned tomorrow, or hopefully you will. So on top of that, you can actually have mold not just from inhalation or from touching it, but you can ingest it. These are wheat berries. The little things there are not worms. I think that they're actually just little rootlets, but you can see all the black speckles on them. So food can actually be another significant source of mold. Most of our grains are probably contaminated. Coffee, unfortunately, is contaminated. And so I think that sometimes when people go on a paleo diet and they stop eating grains or they go on a FODMAPs diet, they may feel better because they're reducing their mold intake. And the reason that the mold is a big issue in foods is that mycotoxins or mold toxins will disrupt the gut barrier, which, as you probably know, is incredibly important, and create a tremendous amount of activation of the immune system in the process. So how do you tell if somebody has mold toxicity versus Lyme versus MCAS? As you can see, there's a lot of overlap between all of these symptoms. So in Lyme, there's the smoking gun of having gotten a tick bite, getting a rash, and then getting sick. So the equivalent smoking gun with mold is that you were fine until you moved into this house that had mold in it, and then you got sick. So most people, it's not quite that straightforward, and I'll talk a little bit later about the synergy between the way that mold and Lyme and the co-infections all affect each other. But there are a couple of somewhat unusual symptoms. There's electric shock-like sensations, and I know you can get them with Lyme too, but I think that there's more neurological symptoms with mold. And Dr. Neil Nathan, whose book I'm going to recommend at the end, talks about vibrating or pulsating down your spine. I've never heard of that with any other illness. Numbness and tingling, so any kind of neurological symptom. Anxiety can be a huge player with mold. And then there are symptoms that relate to the colonization in the sinuses and the lungs, such as frequent sinus infections and cough. So how do we know where the exposure comes from? Because it can be from a lot of different sources. It can be current, and just because you don't see mold in your house doesn't mean that it's not in your current house. But it can also be from past exposure, because if you have been in a moldy situation, there are a couple ways that the mold can take hold in your body. One is something called enterohepatic circulation. I have a slide about that in a minute. The other is that the mold can actually be living in your sinuses and lungs, and actually your gut too. So this is a picture of enterohepatic circulation. Your liver does its job, it identifies the mold toxin, it dumps it into your gut, and unfortunately, it can slip back in through your bloodstream and then kind of get recycled. So just because you have been out of a moldy environment for a while doesn't necessarily mean that you're going to be feeling better. Often people, once they're out of a moldy environment, have a significant improvement, but the mold is still with you often. So testing for mold, generally the general consensus, and again, testing is not great, but we do urine testing. There are a couple of different companies, Great Plains and Real-Time Labs, and they will identify the particular kinds of mycotoxins or mold toxins, and that helps you identify what species of mold are you're being most likely exposed to. And I'll usually recommend that people do something to kind of bring the mycotoxins out of hiding, something to increase their body temperature, exercise, sauna, or hot bath the night before. Now, what about testing your environment for mycotoxins? So this is a very controversial area, and there's a lot of money to be made with testing and remediation. So the first thing is use the cheapest thing you have, which is your eyes and your nose. So if you look in crannies and cubby holes, if you can pull back carpet, smell if something is moldy or musty. The other thing you can do is what are called spore traps, which are basically petri dishes that you take the lid off of and you put in areas of your house. And after a certain amount of time, you close them back up, you send them back to the company, and they incubate them and see what grows out. The advantage is that they're cheap, and they can actually identify what kind of mold you have. There are a lot of other more expensive and possibly more accurate things. There's these ERMI, which is actually looking at the genetic fingerprint of the mold, which can be helpful as well. But the mold testing of environments and remediation are one of those things that is really tricky, because you really want to make sure that you have somebody who's reliable and who's actually going to look for where the mold is. Probably the best way to look for mold are the canaries in the coal mine. So there are a few people who are exquisitely sensitive to mold, like they walk into a room and they feel sick and they need to leave. So I'm going to try to get a hold of some of those people and encourage them to start a business where they go to people's houses and they walk in and they say, now your house is okay, or your house is not okay. And then these are the DIY ones you can get at Menards or wherever. So, all right. So treatment for mycotoxins. The first is stop increasing your exposure. That is obviously more easily said than done. Sometimes it's pretty obvious where the source is. Often it's not. And so if you're not quite sure where it's coming from, I will sometimes suggest that somebody go to stay with a relative or even go to a hotel for a while to see if they feel better there. Now, obviously, I showed you the picture of the hotel atrium that was full of mold. So going to a hotel is not necessarily going to be beneficial. If you have relatives that live in Arizona where it's very dry, you're probably going to, do a little bit better there. But trying to identify where the exposure is coming from. Is it in the home? Is it in your workplace? Schools, unfortunately, are big sources of mold exposure often. And so if people feel worse when they're at work and feel better at home, it's more likely to be their workplace. If they feel worse at home and better out of the home, then the chances are that it's their home. And it can really be tricky because if you own a home and you can't live in it, like, what are you going to do? Sell it to somebody else and make them sick? If you have a lease, how do you get out of your lease? And as you can imagine, there's a lot of pushback from employers, from landlords, from other people who really don't want to, allow you to do something that is going to cost them money that's going to make you feel better. But if you don't get yourself away from the mold sources, it's kind of like you're just bailing out a leaky boat and it's not going to get better. In terms of the food stuffs, there are certainly things you can avoid to just see if maybe you feel better. Okay, so how do we reduce mold in our house? Let's say that you've remediated it and you don't want it to happen again, or you don't want it to happen in the first place. So what mold needs to grow is obviously mold spores. They're all over the place. They're on your skin, they're on the table, they're all over. So we can't really eliminate mold spores. Warmth, so it likes a warm, moist environment. We kind of like to be warm too. We like oxygen as well. So those are a couple things that we can't actually reduce to reduce our risk of having mold grow. The moisture is one thing that we can affect, and most of our houses in the wintertime actually have a humidity that's certainly below 50 and can even be below 20, but at least the mold doesn't grow there. And then they like nutrient sources. So do we. We like to live in houses that have drywall and wood and couches and things like that. So unfortunately, a lot of the things that mold likes, so do we. But the more that you can at least affect the moisture, it's a way to reduce mold. So treatment of mold is a little bit tricky. You kind of want to set the stage by making sure that your diet is as healthy as possible, that you're not bringing more mold into your system, that you're not eating a lot of pesticides and other things that are going to make your liver have even more trouble detoxifying the mold. You want to support the ways that you excrete it. So your skin, doing things like saunas and the liver. And then the main treatment in terms of therapies are binders. So binders are basically things, remember I showed you the picture of how the liver dumps stuff into your gut, but then it sneaks back. So the binders grab the mold toxins and don't let them sneak back, and so you evacuate them in your stool. But the name binder is a little bit disingenuous because it kind of sounds like it's going to grab it with an iron grip and pull it out of your system. In reality, what binders do is it's more like a handful of sand that you're moving on the beach, and a lot of the grains are going to dribble out between your fingers as you move it. And so binders do help you excrete mold toxins, but unfortunately they also kick up the mold toxins. And so people can have more symptoms when they take the mycotoxin binders. So you really have to be careful about how aggressively you do this. You really want to kind of listen to your body, and you may need to start pretty slow. Different kinds of mold probably respond to different kinds of binders, but overall, any kind of binder is probably going to be helpful. And often people have more than one kind of mold or mycotoxin. So it can, if you have 3 or 4 different ones, you might want to start with a binder that is particularly good for the mycotoxin that's at the highest level. So trying to kind of put it all together. So mold, mast cell activation syndrome, Lyme, other tick-borne co-infections have a synergistic effect on each other. They let each other out of jail. They support each other in suppressing our immune systems. And each one of them can trigger activation of the others. And the underlying condition, MCAS, which is kind of a lifelong thing that people have, or the original infection could have been present for a long time before the patient got sick. So I want to illustrate that with a couple of different stories about patients. I had a patient who was generally pretty healthy, 65-year-old guy, very functional, very active, and he got Lyme disease, and he was lucky enough to have his knee swell up. So he got tested, he actually had a positive Lyme test, and he got a month of IV antibiotics. And at the end of that time, he felt better, but afterwards he relapsed, and he actually became not just sick with what we consider Lyme symptoms like achy joints, but incredibly anxious. And so I know that anxiety can be part of the spectrum of tick-borne illnesses. So when I treated him, all of his symptoms got better. His anxiety got better, his joint pain got better. He got most of the way better. So remember at the beginning of the talk, I said sometimes people will get better and then they plateau, and we just couldn't quite get him back to normal. So he was better, but he wasn't all the way better. And every time he overexerted himself, he would crash. Last spring, he called me in a panic because that horrible, overwhelming anxiety had returned, and he didn't know what to do about it. And so we talked about, well, your joints aren't any worse, like what's going on? And this was right around the time that I had discovered the whole mold thing. And I said, what kind of a basement do you have? So it's an old house, unfinished basement, central air, and he was sleeping in a bed that had the air exchange vent like right next to his face. And he had recently turned on the air conditioning. So maybe it wasn't spring, maybe it was more like summer. And so we talked about this, and he was kind of not super receptive. And then he had somebody come over to his house, and this was a canary. This was a canary in the coal mine. The guy is sitting in his kitchen. He says, I'm really sorry, I need to leave your house. There's mold in here. So then he kind of believed me. So he actually didn't even have a door in the basement. So he took plastic and he sealed off the basement. He turned off the air conditioning. He opened the rooms. He got an expensive HEPA filter, and he felt dramatically better with no other treatment. So how do you put this together? This is a house this guy has lived in for 35 years. So how is it possible that he suddenly became sensitive to mold? Well, the explanation is that his immune system was strong enough to keep the mold at bay until he got Lyme disease. And Lyme disease suppressed his immune system enough that he suddenly started reacting to the mold. And so so one take-home message is, as I said, that you can have something that's dormant that gets activated. But the other part of it is that we can't always be assuming that it's just Lyme. Yes, you may have had Lyme, and sometimes it does come back, but maybe if you have persistent symptoms, or if the symptoms come back, it's not necessarily just Lyme. So rather than beating you over the head with more Lyme treatments, sometimes it helps to just kind of look at what else could possibly be going on. So if you don't think of it, you're not going to be able to diagnose it. And so one of the things I'm trying to do is have a higher index of suspicion for these unusual conditions that are not necessarily directly related to Lyme and tick-borne illness, but are certainly something that can make Lyme worse, or that Lyme can make worse. So I promised you I was going to give you some books. This book is called Never Bet Against Akhom, and it's by Laurie Radovsky. Laurie Radovsky was actually at the University of Minnesota. This is a story So I love when my patients come to me and they say, have you ever heard of this thing called mast cell activation syndrome, which somebody did a couple years ago? And I was like, no, it sounds really interesting. She said, call this guy who's at the U. And so I called Dr. Afrin, and he was very pleasant and told me all about it. He said, you know, I know that this is like really hard to believe, but if the tests are positive, you can believe him, but if they're negative, you can't. And I said, I can believe it, yeah. And he unfortunately is no longer in Minnesota. He's now in a private practice in New York. But his book is a very detailed listing of every single possible symptom that you can imagine that's related to MCAS. And I think he does a great job of illustrating like all of the different variations. It's a little bit wonky. This book, Mast Cells United by Amber Walker, is a little bit more approachable, I think, for patients. She does a really great job of going through you know, the important medical information, and there's certainly a lot in here that's useful even for clinicians, but I think it's a little bit easier to access, and she does more information about treatment as well as diagnosis. So Mast Cells United. And then I mentioned Dr. Neil Nathan a little while ago. Toxic is a great book that's kind of a smorgasbord of everything. He talks about Lyme disease, he talks about co-infections, he talks about MCAS, he talks about mold, he talks about porphyria, he talks about electromagnetic frequency. So it's all of the different things that, as Gail said at the very beginning, we're in this toxic soup, and who knows what of all the different stressors on our bodies are causing the problems that are caused. So good question. So is mycoplasma related to mycotoxins? No. Mycoplasma is a bacterium, a very small bacterium that lives inside our cells. And the myco must mean that there's something that's mold-like about mycoplasma. And it's not related to myalgic encephalomyelitis, which is the name, one of the names for chronic fatigue syndrome. And then the third question was just yeast. So I didn't really talk about using antifungals. So I mentioned that they're all from the fungi kingdom. So yeast and mold and fungi all come from the same, thank you, from the same or the same kingdom. And you can, to some extent, use antifungals to treat mold. And yeast is not really a mold, but it will often, thank you, it will often make treating mold harder. I've had patients that thought that they had like yeast overgrowth that I put on antifungals and they herxed like crazy, and we ended up finding out that they had mold. So hopefully that answers the yeast question. If not, you can clarify it or come up afterwards and talk to me. So, okay.
You can start a book.
Yeah, I know. Great. So, if antihistamines don't make you feel better, does that mean you don't have MCAS? Great question. You would think that it would be pretty predictable that if you have MCAS, antihistamines should make you feel better. Unfortunately, I said in the talk that there's no guarantee of what you respond to. So if you do respond to antihistamines and non-allergic symptoms get better, like suddenly you don't have diarrhea all the time, that's pretty good evidence that you probably have MCAS. But unfortunately, there's no treatment that you can say, if this doesn't work, you don't have it. And that's where, to get back to the question of testing, sometimes I'll go back and I'll try to do the tests again if they've been negative, because if I get to the point where all the simple, inexpensive things haven't worked, and I'm trying to do a prior authorization for something that is more expensive or more toxic, I'm not going to get it unless I know for sure that somebody has it. So I will tend to go back and try to get a positive lab if none of the simple things have worked, but unfortunately, the simple things are not guaranteed to work. Okay. I'm being treated for MCAS, however, I haven't been tested. I'm on many antihistamines, mast cell stabilizers. If I forget to take something, I have terrible issues. Started with food sensitivity, then went to chemical, EMF, etc. I had brain zapping, but that went away after being treated for SIBO. Got sick 4 years ago with Lyme. Treated, but food issues started after that. On top of that, menopause and neurological issues. So there's a lot to unpack here. So the first thing that I would say is if you're on treatment and you don't take it and you feel worse, it probably means the treatment is working. So that's kind of like a way to confirm that this is probably what it is. The being sick with Lyme and treated, but the food issues started after that, that I would worry about two things that could cause it. One is antibiotics will cause disruption of the gut barrier. MCAS can also be aggravated by Lyme. And so maybe the food issues started because of that. And then the neurological issues, the menopause is just bad timing. And then the neurological issues. So in terms of, is there anything I can recommend? There are a lot of treatments that target particular symptoms. So something like PEA might be particularly helpful for things like pain or neurological symptoms. But it's such a trial and error that it's not like off the top of my head I could say like, oh, you haven't tried such and such, that's what you should try. So I'm sorry that I can't give you more specific advice, but if you want to come up afterwards, we can talk. Okay, mold toxicity. Do you have to be on binders long term? Not if you're not exposed to the mold anymore. So the idea is that you're going to gradually deplete your stock of all of the mold toxins as long as you're not colonized and making more of them. And the idea is eventually that you can get off of binders. So this is not a forever kind of thing. Who to contact for residential mold detection? That's a really tough question because, as I said, there are a lot of people who say that they do a really good job and they don't necessarily. There is a, I don't know what it is off the top of my head. I may be able to pull it up on my computer when we're done, of an organization that kind of does mold assessment and remediation the way that we would want it done. So I may be able to help you afterwards with that. Okay, low temp. Oh, antabuse, my favorite. Will you invite me back to talk about antabuse sometime? Probably like 6 or 8 months from now, because usually you have like a lot of people in the pipeline. But yes, I will talk about that in a minute. Cancer and Lyme disease, LDI. Oh, what foods have high mold? So as you can imagine, things that are kind of like dried, were wet and are now dry, potentially have more mold. So I had mentioned grains. You know, I don't know how many of you come from farms, but if you look at the corn in the silos, it can be a little bit moldy. The other thing is dried fruit. And then coffee, unfortunately, tend to be high. I would probably, if you wanted a complete list, just Google, you know, foods high in molds and see what they are. And if you do have a diet that is high in those foods, what I'd suggest is just for 2 weeks, eat like none of the foods that are high in mold and see if you feel any better. And that may be a difference. Okay. I think what this says, who are MDs and natural practitioners that treat MCAS in the Twin Cities? So our group is actually pretty good with this kind of stuff. There was a big chunk of information at the last International Lyme and Associated Diseases Society, ILADS conference last November about MCAS, and the upcoming conference, which starts November 1st, has a big chunk of stuff about MCAS and a whole bunch of it about mold too. So in another couple months, all of the local practitioners who go are going to know a lot more about both of those. In the meantime, I would say that the majority of us are aware of it and have some experience treating it. I would say that the best person to treat MCAS is a physician named Shanda Dorff. It's D-O-R-F-F as in Frank. She has a private practice, and she's actually like probably one of the most experienced people with MCAS in the cities. Or she is in the city, she's the most, and she's probably one of the most experienced nationally too. The house was tested and declared clean, but the urine test said mold toxicity. Ideas. So there are a couple of different possibilities. One is that there really isn't any mold in the house, and the urine mold toxicity is from a previous exposure, which could have been in your system for ages. So if you had an experience with a water damaged building or living in a moldy basement 10 years ago, your mold might be from that. The other possibility is that the testing was not as thorough as we might want it to be. And so again, if I can find the name of this organization, that you can go on their website and find local people that are reputable for testing, it might be worth doing that. Okay. And I wanted to say, I just now thought about, I just bought the Retrain Your Brain DVDs. Can you speak a little bit about this? And I'm glad that whoever brought it up. Retrain Your Brain is also called Dynamic Neural Retraining System, and it's looking at the part of your brain called the amygdala, which is kind of the fight or flight or freeze part of your brain. It's the part of your brain that reacts like unconsciously before you're even aware of what's happening. And unfortunately, when people get sick, it can get kind of sent into overdrive. So people that have multiple chemical sensitivity, severe scent sensitivity, other, photophobia, those kind of things can benefit from it. So if you just Google Retrain Your Brain or Annie Hopper, Hopper, you can get information about it. I've started people on it. I haven't been using it long enough to be able to tell you, here's my success rate. But Neil Nathan talks about it in his book Toxic, and I think it can be a very effective way of dealing with multiple chemical sensitivities, PTSD, and actually any kind of chronic illness. The DVDs are, I think it's about $249 for the set, and so that's, comparatively speaking, is a relatively modest investment that can really make a difference. Okay. So if I tested positive for 3 IgG bands, does that mean I would benefit from treatment, or is the Lyme now dormant? So there are two kinds of, there's many kinds of immunoglobulins, Ig. There's IgG, which means at some point in your life, your body has been exposed to this. So if you had chickenpox when you were 4 years old, you're going to have IgG to chickenpox. Does it mean you still have chickenpox? No. The other big category is what are called IgM. So IgM are kind of like the Marines, like they're the first ones on the scene when you get an infection. They jump in and they start fighting that infection. And an IgM band means that you have current exposure. So if all you have is IgG bands and you don't have IgM bands, that's less confirmatory that what you have is Lyme. Now, having said that, all of our testing is so inadequate that it's a little bit difficult to say, I would never treat you if all you have is 3 IgG bands. I think we really go largely by symptom constellation. If it walks like a duck, if it quacks like a duck, we're going to treat it like a duck. And until we get better testing, I think we kind of need to look at the clinical picture and not just be a slave to the labs. Low body temperature, low thyroid tend to improve on its own with Lyme and mold treatment. I would say so. All of these things are going to impact your endocrine system and make it less functional. And so if you have problems with thyroid, often I think they do get better when you treat the underlying problems. Sometimes you need to support the thyroid or the adrenals in the meantime, but ultimately I think your endocrine system is going to improve as you get better from everything else. Okay. At your clinic, where would you start with someone who's had Lyme for 15 years and has only had 1 month of IV antibiotics? So I like to start actually with what I call the four-legged table. So my patients are going to be like, oh my God, there she goes with the four-legged table again. This is actually only a two-legged table. So the four-legged table is diet, sleep, exercise and energy conservation, and stress management. And if you think of your health as a table with those 4 legs, if any of the legs are broken, anything you put on the table is just going to slide off of it. So the first thing that I do with anybody is I start with looking at, are you sleeping adequately? What is your stress management? Are you overexerting yourself? I'll then kind of step back and I'll say, what do I think is going on? Is it Lyme? Is it co-infections? Is it MCAS? Is it mold? What else is going on? Are there other things that are impacting you? And from there then I would say what makes sense. I think most of us use kind of a shared decision making. So I will tell people, here are your options. You could use antibiotics, you can use herbs, here's some other treatments, and talk to people about the benefits and risks of all of those. So that's kind of the way that I do my treatment. So, what's your experience with cancer in Lyme disease? Not a lot. I fortunately have not had any patients, thank you, that have had cancer actively while I was treating them for Lyme disease. I would worry about anything that's going to impact the immune system. So a lot of the chemotherapy may have an impact on that. But if you have cancer, you need to be treated. So I guess I don't really have a lot to say about that. And then low-dose immunotherapy. How many of you heard of low-dose immunotherapy, LDI? So I don't do it myself. Helen, you don't do it either, yeah. There are a couple of places around town that do it. The idea is that you're putting a very small amount of the pathogen in the person's system. It's almost kind of like allergy treatment. I don't know how many of you had allergy shots when you were little kids, but it's kind of that idea of getting your body to recognize it, to treat it. The people who do it report benefit, but I don't have any personal experience with it. So, okay, what antifungals would you use to treat mold? So antifungals wouldn't be my starting treatment. There are a few mycotoxins that you can treat that specifically have antifungals as one of the therapies. And I think in general, it's probably somewhat effective for knocking down the colonization. So not just the mold toxins, but the actual mold spores in your body. But the ones that we use are itraconazole, fluconazole, voriconazole, like all the ones that you would use for a toe infection with a fungus. So, and then the antabuse question, which is kind of like the cool new thing, which hopefully we'll be able to talk about soon. So, any other questions? Any other comments? And I'm sorry, this is why I have people write down questions. Well, can you just stand up and say it a little bit louder?
Myalgic encephalomyelitis.
Oh, okay, yeah. So,
Is that the same as Lyme?
Right, yeah, good question. So I got into this mess about 25 years ago when somebody walked into my office with Jacob Teitelbaum's book, From Fatigue to Fantastic, and said, I've heard that you're interested in treating things in an integrative way. Would you work with me with my chronic fatigue syndrome, which in those days we called it chronic fatigue syndrome. And when I did a Bush Foundation fellowship and started shadowing people to learn more about ME/CFS and fibromyalgia, one of the people that I shadowed was Dr. Karen Verkota. And she said, do you know that 60% of what we call chronic fatigue syndrome in Minnesota is actually Lyme disease? And that's when I went down the rabbit hole and started treating Lyme. So ME/CFS is just kind of a constellation of symptoms. It's a description. Same thing with fibromyalgia. So it's great that we have these terms so that people are not being told that they're crazy. They actually have a diagnosis. But the problem is that they just describe something that's happening in your body. They don't describe why it's happening. I don't think that all patients with ME have Lyme disease, but I think whether it's 60% or some other percent, that is a great explanation for people. And given the fact that conventional medicine has absolutely no resources to cure ME/CFS, I think it's worth looking at the possibility of Lyme disease and all of these other things, you know, mold and everything else.
Do you use antivirals to suppress like HHV6 and
Yeah, so yeah, the antivirals for CFS people have been trying to, you know, get research to come out positively for years, and there are a few people who seem to benefit from them. But I actually think that Epstein-Barr virus, HHV6, all of the viruses, they're just kind of like red herrings. So if you think about Lyme as being like the prince that goes and kisses all the evil sleeping beauties of all of the different infections that are dormant in your system. So I think that the viruses are just kind of like one of the genies that have been let out of the bottle. They're not the driving force. But because we can measure them, it's easier to be like, oh, you have this. Yes, you have a reactivation of HHV6 or EBV, but I don't think that that's what's driving the bus.
so if you could get rid of the Lyme, the HHV6 and EBV would go back to
I think so. Yeah. So this brings up a question. You know, we think about infections as being like strep throat. You know, at the very beginning I talked about how like I thought I was just going to like give somebody antibiotics and they were going to get better. The problem is that there are a lot of infections that can remain dormant in your body. So I mentioned chickenpox when you were 4 years old. You still have antibodies, but you also have the virus in your body. And it can come out decades later as shingles. It's still alive, it's just hiding and dormant. And we're becoming more and more aware of bacteria that can do that. You know, chlamydia, mycoplasma. We know tuberculosis can be dormant in our bodies for a long time. So these are models of infectious disease that are not really well understood or well known. And so I think if you look at the possibility of Lyme being dormant and coming out in your body, so the patient that I talked about, it could just as easily have been that he had Lyme dormant in his body and moved into a moldy house, and that let the Lyme out of jail. So that, you know, we don't really understand how exactly all of these things work together, but we clearly know that there's a synergy between all of these toxins and that make treating any one or the other of them much harder. So, other questions? So great. Yeah, I wish I could have given you more information. Like I said, it would have taken forever, and there's so many like little points to explain that I didn't want to try to, you know, tell you how to treat your MCAS or tell you how to treat your mold. If you have a Lyme provider, then I would definitely talk to them. And if they don't know enough about it, tell them to call me. I'm happy to talk to anybody about that. So I think that's it. We done? So great. Thank you.